Hello everyone, my name is Fer Vanegas and I am going to talk about bioethics, specifically the field bioethics and health. In brief, this field is about guaranteeing the rights of the patients and the duties of the medical professional. In particular, what caught my attention was the principle of autonomy, where doctors must respect the interests and values of their patients. Thus, if a patient refuses to accept a treatment after reading the informed consent, it is not allowed to intervene, even if it is medically the best for them. Having said this, the theory is really simple to understand, but in practice, there are times when a patient doesn't have autonomy. To illustrate, let's take the case of Karen Ann Quinlan, a well-known case of a woman in an irreversible vegetative state and deep coma. After many months of no progress, her family requested the disconnection of life support, but the doctors refused. This is a bioethical dilemma. On the one hand, the autonomy is unclear. It may be the best, but the patient is not part of the decision. On the other hand, it is a crime, since law requires the use of all possible means to maintain a person's vital signs, no matter what happens. To overcome this, the patient can draft a living will, establishing future cares and treatments. Therefore, the patient can request dignified death as an autonomous decision. However, this was impossible to do in Karen's situation. As a result, questions arose about autonomy and limits on decisions. A possible solution, and what was done, is to find a representative who makes substitute decisions according to patient's thoughts. In conclusion, patient autonomy is a fundamental ethical principle, but also a dilemma when the patient cannot express themselves.